Leukemia by Cielo Sanidad and Samantha Sotelo. What is leukemia? Leukemia is a cancer of the white blood cells that affect the bone marrow and the circulating blood. It involves exponential proliferation of colonomyeloid or lymphoid cells and occurs in both acute and chronic forms. Types of leukemia. There is acute myeloid leukemia, acute lymphocytic leukemia, chronic myeloid leukemia, and chronic lymphocytic leukemia. Acute versus chronic. Acute leukemia involves the neoplasm of immature white blood cells that proliferate in the bone marrow and the peripheral blood, while chronic leukemia involves the neoplasm of mature white blood cells. We're going to go over the patient, the medical history, clinical signs and symptoms, dental management, and oral complication management. About the patient. Introduction. So, a 75-year-old Caucasian male patient presents for dental hygiene services scheduled in the morning. He has not received dental treatment in 4 years. The patient notified us that he is diagnosed with chronic lymphocytic leukemia and has had it for 30 years. He has undergone active chemotherapy as well as a bleeding disorder, thrombocytopenia, from the dental treatment. Medical history. So, he is a 75-year-old Caucasian male who weighs 140 pounds and is 5'9". He's currently undergoing chemotherapy, and his medications are omenatusumab and chlorambucil. His vital signs are listed right here.
The generalized clinical oral manifestations include mucositis, gingival bleeding, oral candidiasis, herpes simplex, xerostomia, and bacterial infections. Clinical signs and symptoms of this specific case, since he does have chronic leukemia, we're going to see lumps in the neck, armpits, or groin, also known as swollen lymph nodes, may have a pain or a sensation of fullness in the belly, and can be seen as an enlarged spleen or liver. The clinical signs and symptoms of this specific case is going to be that he does have gingival and palatal enlargement, gingival bleeding, purpura, petechiae, ulceration, and pain. Below are our pictures, are the extraoral pictures and intraoral pictures that we took. Next, we have the dental management and what to be aware of in this specific case. Oral complications management include oral mucocytitis, viral infections, and xerostomia. Oral mucositis may be complicated by the infection of opportunistic bacterial, fungal, and viral pathogens, especially if the patient is immunocompromised. So we recommend that meticulous oral hygiene is essential. Oral rinses with chlorhexidine and a traumatic mechanical plaque removal, including brushing and flossing, are usually recommended. The management of oral mucositis via topical approaches include the use of bland rinses, saline and or sodium bicarbonate solutions, mucosal coating agents, anti-acid solutions, water-soluble lubricating agents for xerostomia to produce artificial saliva. And since our patient is undergoing chemotherapy and radiation, he is at risk for viral infections, including herpes simplex virus and varicella zoster virus. Since these infections are often the result of reactivation of an existing virus, prophylaxis with antiviral medications may reduce the incidence of infection. And last is xerostomia, which may occur in patients receiving chemotherapy due to the suppression of the salivary function. But it's always almost not permanent, so treatment is usually palliative. We recommend meticulous oral hygiene as well, as it must be maintained, and xerostomia should be managed with saliva substitutes. Rinsing with a solution of salt and baking soda 4 to 6 times a day will assist in cleaning and lubricating the oral tissues and buffering the oral environment. In this case, how the clinician should manage the patient with the condition in a dental office, we should provide dental treatment during periods of remission. And medical consultation is advised for pre- and post-radiotherapy/chemotherapy, immunosuppression, and in this case, he does have thrombocytopenia, resulting from this disease before we start any invasive treatment. All invasive dental and dental hygiene treatment should be performed before administration of injectable biphosphonate drugs, and the patient's platelet count should be above 50,000 mcl to safely perform routine dental treatments. If the patient with the white blood cell count less than 2,000 UL or a neutrophil count less than 500 UL are candidates for antibiotic prophylaxis when invasive dental procedures are performed. We recommend at-home brush 2 to 3 times a day, use a fluoride toothpaste, and gently floss once a day. Here is our work cited, and thank you so much for listening.